Okay. The last McGovern Award recipient. To read the recommendations for the last McGovern Award recipient, I'd like to ask Dr. Dolph Hutter to come up to the podium.
Thank you very much, Tim. I'm very pleased to have a chance to read for the nomination for this physician received for the McGovern Award for Clinical Excellence. I should note that there have been many nominations for him over the past years. A senior physician wrote this about the recipient's commitment to innovation. Quote, he has always put the patient and their family first. He's been courageous in adopting new procedures to help patients. Many nominations mentioned the physician's mentorship. He would mentor his younger staff, always providing sage advice and upbeat comment or encouragement when needed most. He would respectfully lead his team in the OR, in the CCU, in the office, or the floor with leadership, direction, and focus to provide the best for his patients and for the institution. And he always did it in his way with a smile and a glint in his eye that made you proud to work with him. He is one of the best trained and worked here ever. Another colleague said, he is a role model for his clinical expertise in being an extraordinarily caring person. For almost 3 decades, he has been the go-to guy in the division for the most difficult and complex patients coming to the MGH from all over the world. Despite the complexity of these operations and complicated courses, he not only provides the highest level of technical care, but he helps manage patients through the difficult perioperative course in a caring and supportive manner. In fact, I saw him for years, seeing his patients every day after the operation to be sure that his care was excellent. Another nominator mentioned his thoughtful interactions with patients. An office visit with him includes a detailed discussion and explanation of the problem, its history and options. It also includes a prolonged discussion about what would happen, about world happenings, about family, and of course, the latest gossip. Many patients told me he's not your typical distant surgeon. Apologies to all the surgeons here. He is incredibly likable and friendly and has many interesting stories and facts to discuss. I would say that applies to all of the surgeons here and at the Mass General. Indeed, as you've heard before, this is not written down, it is such a pleasure to work at this hospital with the great people that we have here, the love we have for each other, the give and take, the learning we get from each other, the absolute candor, the ability to say, I don't know what the answer, what is the answer? I'll go back to my script now. His administrator commented that his family, patients, colleagues, co-workers, and outside referring physicians can always count on him. I constantly receive calls, letters, and holiday cards from patients and family members to thank him on their anniversary of receiving their new heart. I don't think it was a transplant, but the newly fixed heart, and that he has given them back their life, being able to see their children and grandchildren grow, for the ability to see their children marry, to see and experience so much that they otherwise would have missed without his abilities and brilliance. I see and hear that every day, or just about, and I'm so proud to be part of his team, as he had made me who I am today as well. I can personally attest to these comments, having worked with this gentleman for many years. He's always been willing to take on the tough, unusual cases and has achieved remarkable results. He has always been congenial, even under times of stress, both with his colleagues and his patients, and indeed has been a great pleasure working with him. It is with great pleasure that I ask Dr. Gus Vlahakes to come up and receive the 2017 McGovern Award for Clinical Excellence for Surgical Services.
I like the off-script stuff.